Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carl, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way.
Hi, I'm Keanne Armstrong. I'm your host of Being Well. Thanks so much for joining us today. Today we are going to talk about sports medicine, injuries, and different things that fall under that umbrella. And I have with me Dr. Ronald Wheeler. You're an orthopedic surgeon with Horizon Health. So thanks so much for joining me today.
My pleasure. Thanks for the invitation.
Yeah, so let's get started with talking about you a little bit first, and your background, credentials, experiences, and what led you here today.
Well, I'm an Idaho boy,
All right.
and I ended up in my desire to become a physician, and I ended up at Mount Sinai School of Medicine in New York City. And I spent my 4 years there, and then that's an outstanding institution of learning, and I was fortunate to secure a residency at Stanford University. And I spent, I think, forever there, it seems.
Forever.
And I did a fellowship there as well in pediatric or children's orthopedics.
Oh.
And that took me into the whole avenue of sports-related injuries. And that's where my interest began there. At Stanford, of course, there's the great Stanford University Cardinal, and I got the chance to work with the doctors there who were the team physicians and learned at their knee, if you will, about sports medicine, and it's been an avid interest of mine since that time.
All right. So you just said that you were in pediatrics medicine, then it led you to sports medicine?
No, I was a resident in pediatric orthopedics.
Resident.
It's kids' problems in orthopedics, which is the treatment of musculoskeletal problems.
Okay, and then that led into sports medicine.
Yes, it did.
All right. So now, were you ever part of a team working as a physician or anything like that? Because you hear a lot about that these days. Did you have that opportunity as well?
Oh yes, I did. Throughout my entire career I've done that. And my most recent experience was, and no, I have to pardon, I guess, the Eastern Illinois University fans, but I was team physician for Western Illinois University, and that's what brought me out to Macomb, Illinois. And I was there from 2012 to 2015. And actually, last fall, I attended a basketball game here at the stadium, and Eastern won by 1 point. It was an outstanding game.
There we go. Go Panthers.
Well, I was a little disappointed, but it all worked out.
Right, it all worked out.
Yes.
Well, you know what? It's okay. We appreciate your background with Western, but you're part of our team here today on Being Well, and we appreciate that as well.
My pleasure to be here. Thank you.
So let's talk a little bit about sports medicine.
Okay.
Explain to me what it is exactly.
To the public, they don't really understand what it means when someone says they do sports medicine. What it is, it's a closed system, if you will, of injuries that occur during sports-related activities. And it's usually in some collegiate or scholastic high school level, and goes into the professional ranks. And the treatment has been designed and developed to get those participants back in the activity as soon as possible. But in reality, the things that we do, we apply to our general population for similar injuries and with equally good results.
All right. What's some of those? I mean, is it all sports injuries? Do you have maybe patients that come in if they're playing a particular sport over another one?
Well, at WEIU, I took care of all the sports.
All right.
I think there were 16 at the time, Division I sports activities. And those require, at the larger venues such as football and basketball, there's a lot of injuries related to that. Wrestling is, interestingly, a very profitable volume producer for physicians. And
it's one way to look at it, I guess.
Exactly. And because even though the players are smaller in number, the injuries are about the same.
Really?
As it is football. And
I wouldn't have thought that.
Most people do not, but I've probably treated more dislocations during the event in wrestling that I have in football.
Really?
Yeah.
Isn't that something? That's an interesting fact.
And so what we do is we have that sports injury and we take care of that, but the same treatments that we provide the athlete, we do in the general population as well for their injury, except the goal is a little bit different. In Division I sports is to get them back participating safely as soon as possible, and in the general population it's usually trying to get them back to a position where they can go back to work.
Okay, so even though we're talking about sports medicine today, you treat athletes and non-athletes.
That is correct.
Okay, but it's just a difference in what caused that injury, whether it was a sports affiliated injury?
Exactly, and the goal is to get them back participating in that event rather than going back to work somewhere. That's the real difference.
Okay, is there any particular types of injuries that you want to talk about today?
I would like to focus a little bit our discussion on shoulder injuries.
All right.
It's a misunderstood area in medicine generally, as well as in the general population. And like I said before, and I think you alluded to, when a layperson hears that the physician is involved in sports medicine, they don't see that it's readily applicable to them.
Mm-hmm.
When in reality, it just means that individual has more experience in that area, having treated college or professional athletes with that same type of pathology. The shoulder is a very interesting structure, and that's why I like it so much. The hip joint, for example, is a true ball and socket joint, and that means you have a ball that sits up inside a socket.
Mm-hmm.
And the hip then moves inside the socket, and that's a true ball and socket joint. The shoulder is considered a ball and socket joint, but the socket is very shallow, and the ball sits up against that and is held in place with the lining of the joint, which is called the capsule, and the tendons that are around it that go down to make the arm move. Since we can move our shoulder in so many different directions than you can your hip, it has to have that shallowness in order to do all the things we want our shoulder to do.
All right.
Unfortunately, if there's any rent or defect in that lining, then the whole shoulder is in a state of dysfunction and has to be corrected. Shoulder pain is tremendous pain, and you can ask any of your listeners that are at home and they've had shoulder surgery, and I say that's one of the more painful joints, they are right now nodding their head in agreement.
Yes.
Because it is definitely true. Shoulder injuries are painful injuries. So what happens in a regular hip joint, you have the ball and socket joint and the lining, and then outside of that the tendons come down from the pelvis and insert at varying places on the thigh bone. And those muscles then move the joint. Not so with the shoulder. Because of the nature of the shoulder and the variety of movements that we can achieve with the shoulder, instead of that tendon passing over it and inserting into the bone, it merges with the lining of the joint or capsule, and that combination of capsule and tendon is called the rotator cuff.
All right. Do any of these models here illustrate what you're talking about?
I
Do you
think
want to
this
show
one,
any of these?
yes, I think this one does fairly well. This is the rotator cuff, as you see here. It's a thickened material. There's tendon portions, as you see, as they insert and connect to the muscle from which they derive their strength. And then those come down and insert on the bone as a tissue called the rotator cuff. And if you have a defect in that, then this shoulder is not going to move correctly, and hence is going to need treatment. And that's the real question is, what is the treatment for a specific injury?
Mm-hmm.
And the number of types of treatment that we have extends towards exactly the number of the injury types that we have. For example, our most common injury is to this area here, and this bone underneath here is where this inserts. This is right above the joint in the ball called the humeral head. And this rotator cuff, major portion right here, is called the supraspinatus, and it goes into the bone right there. If that gets pulled off, you have difficulty raising your arm forwards, or moving your arm sideways, or rotating it. It creates a great deal of weakness and pain.
Okay.
The individual then doesn't use the shoulder because they can't, and then the shoulder tightens and they lose further motion because they're not using it.
All right. Now, what is maybe a sports injury that is related to that happening?
You've got a lineman that's 6'5" and weighs about 280 pounds on defense, and the offensive lineman blocks him, and the runner goes by, and he puts out his arm to stop the individual, and his shoulder gets pulled back and he tears that area.
All right.
He also
Painful.
can tear inside the shoulder, and it's very painful, but then he cannot use the arm, and he may be even prone to dislocation of the shoulder, depending upon the combination of injuries that can occur.
So then surgery is what needs to happen at that point.
Exactly. We need to reestablish his anatomy so that the function will reflect an intact rotator cuff.
Okay.
Nowadays, in the 21st century, we are doing most of this surgery through a scope that we look inside the shoulder, and that helps reduce their downtime, but they still have to go through the recovery phase, and then they still have to allow the tissues to heal. Now, my football lineman that injures his shoulder, I will not let him play competitive sports and plays, even practice, for maybe 6 to 9 months.
Oh, wow.
Not unusual. Now, I submit that anyone that is gainfully employed will not have much of an income or even maybe a job if he's out for 9 months.
Yeah,
so we have to get
exactly.
him back productive earlier than that without injuring his shoulder when he does go back to work.
Okay.
And that's the difficulty. Thank goodness for physical therapists.
Yeah, and thank goodness for orthopedic surgeons too to help create that mobility and the injuries. Now we have a couple of other models here. Do you want to talk about those at all?
Surely. This is one that I wanted to bring to show you. And this is a very interesting one because this was designed by the French, probably 15 or 17 years ago, and it didn't work very well. And it fell into disrepute. And then has been resurrected in our country because what it allows us, for a patient, let's say she's 75, and she falls down the stairs and tears her rotator cuff. She's trying to take her wash down to the washroom, and she falls and she tears her rotator cuff. And because of her age and the fact that she may have already had some shoulder problems, that's not fixable. But she now has pain, and she's getting arthritis in the shoulder, and the ball starts to rise up in her shoulder, so she can't use her shoulder anymore. The question is, what are we going to do for her?
Yeah. There's a lot of people that suffer from that same example.
Every day.
Yeah, every day. So let's talk about what are you going to help those
So what
folks
happens
with?
is you can't do a standard shoulder replacement like we do a hip or a knee if she doesn't have a rotator cuff. The standard one will not work and will fail dismally, and she will be worse off.
Okay.
So this design, as I mentioned, was started in France. It actually is different in that you change the ball from the thigh side, the arm side, and you put that ball on the socket side.
Okay.
So you're reversing it, and that's why it's called a reverse total shoulder.
Huh.
And then you take the the humerus bone, and you prepare it so you can place an implant inside there. Now you have the ability to put in a surface and put this there, and now you can move your shoulder very successfully without an intact rotator cuff.
So this would actually be somebody's shoulder.
Yes, correct.
And is that magnetic?
I wish it were, but no, it isn't.
Okay,
But this
I
happens
thought
to be.
okay.
It does snap. The one we put in
Is not.
is pressured into position and stays there because of the muscle pull.
Okay.
But you can do this surgery and give them, 1, pain relief, and 2, restoration of most, if not all, of her function without the use of rotator cuff because she doesn't have it. So then she can have full motion with the muscles other than her rotator cuff.
Isn't that amazing?
It's a marvelous thing, and it's now becoming more and more popular. And this is a surgery that we do right at Paris Hospital at Horizon in Paris, and it's very successful for the patients. And if you have an individual who wants to play competitive sports, and then he wants to become a professional football player, and he has an injury that may be the end of his career, and you get him back so he can participate, he is a grateful patient. And these patients mimic that satisfaction.
Yeah.
Because their life has been given back to them. They don't have that horrible arthritic pain they had in the past, and their function is restored, so they can live essentially a normal life.
Yeah, well, it's horrible when you want to move your arm and you finally figure out how limited you are when you can only lift it so high. And if you are trying to do the laundry and take your laundry and fold it, your arms just don't work the same if you can't have that mobility.
That is so true. And so the orthopedic surgeon can participate in the restoration of function and lifestyle for the patient who has been injured, and that's why I like orthopedics so much.
What other body parts do you see more regularly than maybe some others?
See a great deal of hip problems and knee problems, either sports type related, playing basketball, intramural sports, the weekend softball slow pitch team for the old guys now, and some of that fast pitch that the young women do that are so exciting.
No kidding.
And they get those injuries, and they still want to keep playing. We have I have, I think my oldest patient that was a runner and set a record was 79 years of age, and he holds the I think it's the 40-yard dash for them in that event.
Oh yeah.
And if he had to stop, he would be very unhappy. So we have treated him a number of times to keep him going. Hips and knees are very common. As we see more and more now as our population is aging, we see more and more arthritis in these patients, but yet they still want to maintain activity. And the arthritis of their hip or knee limit them from what they want to do.
Okay, so what causes arthritis? You hear a lot of people have it. Is there anything people can do to try to prevent it, or what brings it on?
Well, it's once you get it, it's yours. How severe is determined by your genetics. For example, if you're Northern European, so from France, Scandinavia, England, Germany, you will get arthritis. If you're from the southern part, the southern Mediterranean area, it's less prevalent. But if you come from Northern Europe, like most Americans have that gene in them somewhere, they are at risk of developing arthritis. And the arthritis then has to be treated either with or without surgery. Mm-hmm. Most of the time, quite honestly, we treat them without surgery.
Really? That's what
Yes.
my next question was going to be, is what treatment options are available for sports injury and non-sports injury outside of surgery? Like, what kinds of things do you do?
We have, as orthopedists, have a close relationship with physical therapy.
Mm-hmm.
That's the number one form of treatment.
All right.
And it helps reduce pain and restores function and strength. As we get older, we become less active, although we think we're active,
Mm-hmm.
but compared to when we were 19, we're very less active. And so when we have an injury, the margin between function and restoration becomes quite wide, and we have to start now getting them going fast as quickly as we can so they don't lose muscle mass and muscle function.
All right.
And therapy does that for us. There's a variety of injections. It depends on the extent and severity of the arthritis. There's a variety of injections that can be given for inflammation, and a protein we can instill into the knee joint, which will keep the nutrients around longer and help the patient for up to 6 months with reduction in pain up to about 80%. So that can be very successful. Those are non-surgical treatments. The more severe arthritic patient, I recommend they exercise in water, hydrotherapy, because then they're not fighting gravity. They're anti-gravity. It's the closest you can get on this earth, and that can be very beneficial to the patient. Unfortunately, in the state of Illinois, the biggest problem that I see that we face in patients with arthritis is obesity, and that just gets in the way. Now, the Europeans have studied this for 40 years, and they've got 30,000 patients been followed their entire career. And they've demonstrated to us that obesity or carrying around too much weight has nothing to do with the cause of arthritis. You would think it would, but it doesn't. But once you have arthritis, then it hastens the demise of that joint. It wears out that knee joint faster. And in fact, just a couple of years ago, it's now been recognized that one of the causes of arthritis of the knee is working in a work-related activity for 25 to 35 years on concrete. So you got a guy who's 65, been doing this for 35 years. He's going to need some more aggressive treatment for his knee problem, and usually those patients will come to total joint replacement.
Yeah. Well, I think it's interesting that being in sports medicine, we're talking about sports injuries as well as other, non-athletic injuries and all the different surgeries, treatment options. So you've probably had a lot of grateful patients over the years, I'm sure, when it comes to both. Do you have any memorable experiences with patients?
Too numerous to count.
Yeah.
I find that every patient who has a successful hip replacement, and I've done in excess of 6,000 hip replacements, and knee replacements about 3,000, those are very grateful patients because they can then hold their grandchild. They can pick them up. They can do their own shopping. They can do their own house cleaning, et cetera, et cetera. In other words, we return them to a normal, for them, lifestyle. Isn't that exactly what we do for the athlete? Exactly, just a different treatment. Many of the same modalities that we do for arthritis or our older patients, we do for our younger patients as well, who are athletes.
Okay.
I'm glad we don't do knee replacements on them, however.
Why is that?
Because they don't need it, and they will not do well. They're too young.
Oh, okay. So you kind of, as a last resort, when folks are older, you go towards the knee replacement. Is that what you're getting at?
Yes, ma'am. Because hip surgery, total knee replacement, and total hip and knee replacement is a last end treatment.
All right.
That means that we are going to change and modify the joint itself. And we're going to put implants in there that will now move instead of the arthritic bone against arthritic bone. that has got some complications inherent to it. So you have to be very selective in your patient population to determine the best result for them. And that is probably the largest challenge we have, because we have patients who come to us because Aunt Martha had her surgery and she's doing great, and they weigh 400 pounds, and we have to get that weight off so that the surgery can be successful for them.
So it varies depending on the patient and what treatment options need to be made.
Exactly.
Yeah.
And we do that in concert with the patient and with assistive departments such as physical therapy and dietary and our weight reduction programs that we have in effect in Paris.
Okay. Well, so if a patient is having some issues with either whether they're an athlete or whether they're not, do they start with their primary care physician and get a referral to you? How does the process work?
They have the right as individuals to call in if they do not have a local primary care physician, but it's always a good idea to involve your primary care physician. He will support that referral, and he can assist in organizing that, and they can also then participate with us directly in the care of the patient. For example, if you have a patient that needs therapy, I advise the primary care that I'm going to send them for therapy, and that I also want them to see our dietary, I want them to see about some water exercise programs. And that can directly involve our primary care physician. We have excellent physicians in Paris, and it's really a pleasure to work with them. And so we're being successful in our treatments, and that's because not one person's doing it, everybody's doing it.
Yeah, you're working as a team.
Exactly right.
Helping a team?
just like Division I football.
There you go. You kind of circled back around, didn't you?
Exactly.
So we've talked about a number of different injuries. Have we left anything out that comes to mind that you'd like to cover while we have a couple of minutes left?
Well, I think most of our population is either had or is very aware of a surgery called arthroscopic surgery.
Yeah.
And that's where you use a scope and introduce that into the joint. No large incision, but that tube is light instilled, and you can actually see inside the knee, for example, better than you can by opening the knee and looking inside.
No kidding.
It's marvelous.
I didn't realize that. I would have thought you would have been able to see more the opposite way.
Well, that's what I thought too until I got into it. In fact, I did the 2 first arthroscopies at Stanford University in 1979. And I got approval for that, and we did the scope with Dr. Michael Dillingham, who was team physician for the 49ers. And we scoped these 2 knees. It was so bright that we thought we were blowing out our retina because we couldn't hardly see. But we could see inside the knee better than opening it up and with lights looking in there. And we knew we were onto something.
Yeah.
And Dr. Watanabe in Southern California, UCLA, is the one that really got this going in the United States, and others as well. And now there's not a joint in the body you can't scope.
Really?
Yeah.
That's interesting.
It's marvelous. And we do a lot of soft tissue procedures now through a scope that we never even thought we were going to be able to do. And that's pretty exciting.
Yeah, it is exciting. Is the recovery process shorter with a scope?
Exactly right. Definitely shorter as the patient participates in her rehabilitation, his or hers. And yes, it's a great benefit to the patient. In the old days, we used to have to open the tissues, and now we can do it through a scope and be very successful. We're doing them more with carpal tunnels, for example, the wrist surgery. We can look in the wrist joint. The smallest joint I've done professionally is the knuckles of the fingers.
Oh, really? Yeah. I think that would be difficult.
We have a little teeny scope, and you can see very well in there, and you see if they've lost their cartilage in there or not. There's a lot of things that you can do even with the small scopes. And then we have a very large type of scope for like hip repairs and hip surgeries for patients who have impingement inside their hip. Unfortunately, that usually occurs patients in their 20s and 30s, and they tear the lining of the socket called the labrum. And before, we didn't know what to do with those. We thought that was a form of arthritis. It is not. It's a form of development of the socket and the ball that goes up into it itself.
Okay.
And by treating that early, you can take away the risk of arthritis because of that pathology.
Wow.
And that's really exciting. And I say 5 years from now, the stuff we're doing now will be considered archaic. They're that good.
Wow, that is so amazing. So many treatment options. So I guess the message I'm hearing is don't let surgery scare you off, because there may be some other options out there for you. No matter what the injury is, no matter what the problem area is, seek out some treatment and see where it goes. That's
exactly correct. That's what we try to tell our patients. To me, joint replacement surgery is last resort surgery. And I'll make a prediction.
What's that?
Right now, we're doing a lot, I'm sure you've heard about them, all the different materials like placentas that have these cells that become any other cell in the body given the right stimulus. They're progenitor cells, and they're found in heavy doses in certain places. But we can find them in fat, We can find them in blood, and we can find them obviously in places like the placenta or etc. And that tissue is taking us to the future. I would predict that in 20 years, you have arthritis in your hip. We will not replace your joint. We will operate on your shoulder, take out a piece of your cartilage, grow it on a model that's made from a CT scan or MRI scan of your hip, and then we will resurface your hip with your own cartilage.
That is so interesting. I'll tell you what.
That's dynamic, isn't it?
Yes, it is dynamic. So many interesting options today. I really appreciate you being on the show and explaining all this information to our viewers. Thanks for being here.
It's been my pleasure. Thank you again for that invitation.
Absolutely. And thank you for watching this episode of Being Well. For more information, visit our website at weiu.net and click on Being Well. We'll see you next time.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carl, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way. Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.